So the final impact corresponds to the ambitious objective of the European Commission. They have a wide scope, so the Mood Consortium has reflected since the proposal how Mood will contribute to these objectives, thanks to the method to approach IMPRESS. So you can see this long-term impact. On the kind of end of project expected outcome correspond to the integration of Mood tools and services into the existing epidemic intelligence services. So this is the main final outcome, but many intermediary outcomes have been identified and reviewed. So a strategy of co-creation have been chosen in relation with a central hypothesis that it will ensure that the tools and services developed will align with the practical needs and operational realities faced by the end user, being the practitioners of intelligence, epidemic intelligence in public health and animal health agencies. Mood has been organized into around 8 work packages in a linear way, but then also around 7 case studies to better organize the interaction with end users. So it was a transversal organization that was quite demanding in terms of human resources and time, quite demanding in terms of coordination and facilitation of the study cases. But we kept it quite flexible. So at the very beginning of the project, we have implemented a qualitative study to assess, to have a very global overview of the needs of innovation of the practitioners in Europe. We adopted a stepwise approach to identify the problem faced by the practitioners with 2 rounds of interviews. And then we have validated the priority problems to solve, and also the most adapted solution to the work conditions of the practitioners with a workshop. And we have identified 3 axes of intervention. First, a stronger peer networking for the different steps of the epidemic intelligence. Better data integration and data access, and finally an access to semi-automated tools for detection, monitoring and assessment of risk, with also a methodological guidance. So we have organized activities around several big steps of intervention. First, the assessment of the needs and the conceptualization of the tools. Then the development of prototype, the first prototype, with several loops of interaction called learning loops. And the step of prototyping has been extended to late 2023. So it means that it was possible to measure the outcomes only in 2024. So to monitor this impact-oriented project, we have organized 2 main activities to choose the final impact and to reflect on how we could reach this final impact. So it was so we have used several tools like the impact pathway review to identify the logic of intervention that could allow us to reach the impact. And also we adopted an integrated approach, epidemiological and socio-anthropological approach with interviews, analysis of meetings and questionnaire to monitor the process and draw lesson learned. So here there is an example of a review of the impact pathway. On the left, you can see the resources, the input leading to outputs, the different scientific production, leading to the main output, the mood platform in the middle. And you can see also that to reach the final impact in green, you have several branches of outcomes in red that can be regularly reviewed in relation with the probable uses of the tools. We have reviewed also the risk when we have at the start of the project identified some risk, some barriers, and when then these risks were mitigated, they have been removed and replaced with updated risk. And we have used also many key performance indicators in pink that you can see in pink to monitor the process. So we had 17 KPIs, key performance indicators concerning to the outputs to monitor the close monitoring of the scientific outputs, the communication and the co-creation process. And we can say that we have reached the targets for 16 of them, with very good results in terms of publication, for example. In the number of publication and impact factor of publication, and also regarding the quantitative aspect of the participation. Here you can see the graph with a steady increase of the participation distributed in the different format of exchanges, interviews, questionnaire, workshop, email exchange, and meetings. The analysis of interviews with partners and users led us to lesson learned useful to implement a co-creation process. And these challenges are distributed around 2 levels, organizational level and operational levels. And 2 main areas of challenges have been identified. The project organization, like the common understanding of the concept of co-creation. It was a challenge. The scientific goals, like having an interest in the co-creation process, even if the co-creation is not a research question for the researcher, but also the communication and the involvement of the different stakeholders in the process. So the main challenge of the current year was to shift from the tools development to the finalization of the platform. So during the last General Assembly, the different modules have been tested during testing session and assessed with a questionnaire. And at the beginning of the year, we start to test the platform as a whole, first internally during a test leader meeting, and then with users during the final workshop. So we have used a different kind of questionnaire. And currently, you can find 2 tools online. The quick feedback questionnaire to collect expectation and suggestion, and the impact survey to collect perception and outcomes. So during the testing session, we have identified the main areas of improvement identified by the users, that are the technical improvement of the platform, the guidance for navigation and functionalities, the maintenance of the tools and update of the data, and the communication with the community. And we can say that, in fact, all these topics have been discussed during the testing session. they are not all solved, but all these aspects have been discussed. So, in conclusion, the theory of change was a useful tool for adaptive management and communication with the European Commission. We have seen that multiple dimensions must be taken into account to ensure the sustainability of the change of practices, and so the outcomes. Now that we observe the uptake of the platform, we can have a really more precise outcome evaluation. So the survey is currently ongoing. And for the future, a main challenge is to continue the communication with the community in routine, and to have tools to monitor the platform users. So I thank you for your attention, and we can ask any question.